Hi, everybody. It's Father Gar with St. Thomas, and
Hi, it's George Phillips, your senior warden.
great. So, we wanted to give you a quick update about where we're at with COVID. I know a lot of you are getting vaccinated, and a lot of you have been asking when can we come back to worship and when can we come back to activity. So, we have some good news and some plans. We've been thinking about this and praying about it, and the vestry met last week, and we're kind of being cautiously optimistic about where we're headed, but we want to be careful. So I'm just going to hand this over to George. He's going to talk about where we are with community rates and all of that different stuff in the what the medical community is seeing.
Sure. Thanks, Father Gar. Well, we're really fortunate that we have started to see a significant decline in both the case rates and the testing rates in our community. The Johnson County numbers show that we probably are having about 500 new cases per week throughout the county, which is the lowest we've been in months and months. And for new test results, the rate of positivity is sitting at about 12%, which is not as great as we'd like it to be, but it's a lot better than it was. And those numbers have sort of started to reach a plateau where they're still going down, but just really slowly. We've seen the majority of the big drop off, which is really great. And we hope we'll see more, especially as we start to get more vaccine out there in the community. That's really the next step. But we're excited because it's looking a lot better than it has been. And we really do feel like that it's the right time to start to open up small in-person groups. We don't want to back away from any of the safety strategies. We're going to keep all those in place, and we'll talk more about those in a few minutes. But the good news is those rates really have come down, and so now's the time that we can start thinking about opening some things back up in the community.
Some of you want to know, I appreciate everybody who's sent me the information on whether they've gotten vaccinated or had COVID. I knew a lot of the people who'd had COVID, but I wasn't for sure, and that's helpful. So if you haven't sent that information, say you got an appointment this week or you just got your vaccine, go ahead and send it to me and just give me an update. I'm keeping the list. It's just my list. And then once we're done with this, I'll delete it. So I'm not going to share that with anybody. But I can tell you the aggregates. So right now, as of today, we've had 170 people, believe it or not, at St. Thomas who've been vaccinated. We've had 60 people who've had about 60 people who've had COVID. And unfortunately, we've had one person who passed away from COVID late in the fall last year. And so we're lucky in that it's only been one person. I really consider that fortunate. I know my colleagues in other churches have faced a lot more deaths in their congregation. That turns out for vaccinated, we have 21% of our folks who are 16 and up. So adults in the Episcopal Church are considered 16 and up. So 21% of the congregation is vaccinated, and 7% have had COVID. So that's about, if you add those up, that's about the percentage of people that have some protection. People who've had COVID have some limited protection. They still don't know everything. I think the vaccinated folks certainly have a lot more protection. So that's great because it's a lot of people, but we need that number to go up a little more. So before we get fully open, so we would still be at risk. Part of what we talked about, which George alluded to, is we're going to have kind of a stage one reopening. So we're going to start, and basically we're going to go back to where we were in late July, August, and September, which is small groups and other ministries can start meeting. We're going to have 3 spaces open for folks, and that's because they're large, wide open spaces. Parish Hall 1, Parish Hall 2, and the sanctuary. Obviously, if somebody had a few more people, they could use the Parish Hall completely open by itself. And we've got some numbers in mind for that. What we used last summer was 25 in each of those rooms. Sanctuary can house a little more, but we're going to keep our numbers at 25 to start as a sort of limit. And so that means people, we got multiple groups in the building, but we just got to keep them from interacting together too much. So you'll need to call in to schedule that. So don't just assume you can have a space. You need to call and schedule with Mary Beth so we're not overbooked. Same things as we've done before. We want to keep 6 feet of distance. We want to mask and we want to keep our hands washed. And we're going to recommend that you double mask when you come in the building. We're going to have paper masks for you if you don't have them. So the thing that they say is to have a paper mask and then a cloth mask over it. And that makes things even better for both you and for the other people around you. No one's going to police that, but we're just asking that you respect that while you're in the church. And again, we'll make a bunch of paper masks available for you. And so if you don't have one, you can just grab one of those and throw it on for the little bit that you're at the church, and then toss it when you go. And drinks are okay. You just lift your mask up, take a drink, put it back down. But we're going to still not have any food for a while. And then outside, it's not quite warm enough yet, but as it gets warmer, outside events are always encouraged and safer. And so you can reserve the Apostle Garden or the fire pit area still. So you want to talk about the next part, George? What we might do for more activity down the road, which we're not quite ready for.
Yeah, absolutely. And I just wanted to go back and really reinforce those safety mitigation strategies that you mentioned. Keeping the physical distancing. I like to call it physical distancing as opposed to social, because we want to be socially interactive. We just want to do it with enough physical space between us. Good hand hygiene, washing those hands, using hand sanitizer, and the masks with the double masking, as you mentioned. And the other piece that we sometimes forget to say, because we think it should be obvious, but sometimes we forget, is if you are having any kind of symptoms, whether you've been vaccinated or not, please don't come to an activity at church. Let's just continue to have an abundance of caution. Even though we're trying to do all the other things, don't say, oh, well, it's safe with the other stuff. I can go with this cough and runny nose and, whatever else. If you're having symptoms, please stay home. Let us know at the church if you need anything, and we can help you in that regard. But let's all just continue to really be conservative and cautious about that. So we're going to continue to watch the case rates. We're going to track those. I check the county's stats pretty regularly, and we watch the trend over time. So we're going to watch over the next 1 to 2 weeks and sort of see, are we continuing to have that plateau, or maybe even a little bit more of a decrease? If anything starts to bump back up, we will watch that very closely and consider pulling back from some things if we have to. But I'm really hopeful that the way the trends are going in the county, we won't have to do that. We're going to continue to have online worship available, so that if you still are personally not comfortable, you're not going to lose anything. You will still have all the access to the great online services that Father Gar and Mother Kelly and the rest of the staff have put together. And the biggest thing to remember is we will continue to kind of spread out. We may even have some different types of services that are a little more attractive, perhaps for those of us with young children and those of us who don't have young children. And so we may be able to use different parts of the church to have different services going on. So I think there's a lot of excitement about using some of the new equipment that we have in the parish to really help support the right kind of offerings, and yet to do it safely and in the right way to keep everybody healthy during this crazy time.
And then I want to stress that I think we're really vulnerable right now because we've been in lockdown for an entire year in some way. We've been kept away, and we're finally getting some hope and some release. And the temptation is just to drop the mask, start doing stuff, go see people even before you're vaccinated, and just take some risk. And I just want to caution you that we have to just continue to be patient for a little bit longer and let those vaccines get out into the community. I'm really could see a situation where we get too cavalier and suddenly we're just right back where we were. And that would be really hard on everybody. I'm not talking about just St. Thomas, I just mean in general, in the general society. Just to encourage your folks to be careful and continue to do all the things we've talked about in general practice, even if you're vaccinated. That's the recommendation from CDC right now, is that we have to keep going just to help make sure that virus gets pushed back. You got anything else, George?
I think just two other quick things. One, I think we mentioned this earlier, but just to reinforce that we still will intend to do a lot of activities outdoors when the weather permits. And this weekend has been a gorgeous example of some great weather to be able to get outside. And so we will continue to offer some outdoor things as appropriate. And then the second thing, I just wanted to throw a shout out to the vestry. We have a brand new, group that just joined on because we just had the annual meeting recently. And we spent some time at our first vestry meeting together as a group talking about this very issue. And you should be proud of the group that is serving you and the parish as the vestry. It was a very thoughtful, a very deep consideration conversation with really weighing nicely the importance of starting to return to some sense of normalcy, the importance of the various liturgies that we can and can't do, and also some real good consideration of health and safety. So it was a great conversation. We're all on the same page in this regard, and so I'm really excited about what that indicates for what the vestry is going to be like for this upcoming year.
Yeah, we had a great start at first meeting, and we had to make some big decisions immediately. And so it's a great group. You guys did a good job electing and nominating folks. And we've got a lot coming up. So I think I'm excited for our future and excited for the changes, and I'm eager for us to get back, but I also want us to be cautious, and I always feel responsible. We will make it possible for all of us to participate in some way at our comfort level, given the situation we're in. So it might mean that you come in and we've got the FM transmitter. We may be doing the service in the sanctuary, and we'll broadcast it out to the parking lot. So if you don't want to come in, you can at least still come there. Or we'll be spread out in the parish hall, and we'll be spread out in the sanctuary, or we'll do multiple services. We'll do extra services to kind of make sure we can fit people in. So just know that, yeah, it's a lot of work, but it doesn't matter, because that's what we need to do right now, and things will get easier down the road. So I think I'm excited. Do check in if you are sick or something's going on. Make sure you let us know if you happen to get exposed to COVID. We want to support you. And just if you have normal illnesses or other things going on, make sure you let us know. We don't get to see each other very much, and that is sometimes missed because of that. So you guys have been great this last year. We're almost there. We just got to keep going. So thanks, George, for your time.
Thank you. Appreciate it. And great to virtually see everybody out there. So stay safe.
We'll give you an update here in another 10 to 14 days about what's next. Take care.